Hello there. Today we'll be talking about something quite interesting but painful. I tagged it dealing with painful sexual intercourse. Welcome to Your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Yide Jinodu. If you are not yet subscribed to this channel, I know you're missing out. Why don't you subscribe right now and hit that notification bell so you get notifications every time I post new videos. Now straight to the chase. Painful sex, what we call dyspareunia in medicine, can be defined as persistent or recurrent pain that occurs just before, during, or after sexual intercourse. How common is this? Believe me, it's very common. A lot of women are suffering dyspareunia, that's painful sex, and suffering in silence. According to a study done in Alex Ekweme Federal University Teaching Hospital, Abakaliki, women within the age of 21 and 30 were taken as their sample size, and it was found that 36% of them in their reproductive age had dyspareunia. Unfortunately, only 16% of them sought after medical assistance. Now it shows that a lot of people have this problem but still don't complain about it. They accept it as their fate. Today I'll be enlightening us and making us understand that you do not need to have painful sex. Have you heard women say this thing? Sex, is it food? Yes, it is food. If your wife is complaining about sex, I think you need to listen. She might indeed be having pain. Don't get offended all the time when you want to have sex and your wife is running from you just because she's having pain. Now there are various causes of painful sexual intercourse. I'll be listing a few. I categorize them into three classes: physical causes, psychological causes, and both. Now I'll start with the physical causes. The physical causes, you could have genital injury. Now you know the genitalia, the genitals are the private part. So genital injury, especially with women who are circumcised, female genital mutilation. A woman who is circumcised will have her clitoris removed. Now the clitoris is a counterpart of the glans penis, the cap of the penis, the very sensitive part that makes you reach orgasm. Now a woman who has her clitoris removed would have difficulty reaching orgasm or having sexual pleasure. I'm not saying it's impossible for women who have their clitoris removed can't have or can't reach orgasm, but it will take a long while. Another genital injury could be from a road traffic accident, a pelvic accident. A woman was involved in an accident and probably affected her pelvic bone. She most likely would come down with painful sexual intercourse. Also, it could be a complication of pelvic surgery. Surgery done around the pelvis could be a myomectomy, could be surgery from a uterine prolapse. Yes, now this next point I like so much because it's a very common cause: inadequate lubrication. Now let's calm down. We see a lot of men who always feel like they are the jagaban in the bed. Alright, you don't care if your woman is lubricated or not. You are just interested in having sex and ejaculating, just feeling like a man. Jagaban, 37 kilo. Calm down. Now many a times before the sex act there is reduced lubrication from the woman, probably due to reduced or non-existent foreplay. Daddy, calm down. A lot of our parents, mothers, don't even understand what orgasm is. Why? Because our fathers were selfish. All they wanted was just to come in here and feel good, yeah. Man of the house, Sex between a man and a woman is a negotiation. It is very easy for a man to reach orgasm, but it's more difficult for a woman to reach orgasm. So for your wife to reach orgasm, you need to learn to be patient. You need to learn to deal with anxiety. Don't just go in, go out. Foreplay, and don't just start with the act of sex. Sexual intercourse between a man and his wife is a negotiation. Men, calm down. Let us calm down. It's my right, I must have sex. Doctor, this woman does not like sex. What is her problem? All the other small girls outside, they do it well, but this one, Calm down. You need to be more patient. You need to understand your wife. There are so many things over around that inadequate lubrication. It could be a state of mind. You're actually offending her. You need to learn to stop doing that. I will go there when we talk about the psychological causes, but you need to engage more in foreplay. Be romantic. Don't be aromantic. That's the opposite of romantic. My version. You need to be romantic. Start from subtle text messages before you come home. You want to have sex when you get home. Yeah. Send text messages. Tell her how much you love her. How she smells. Tell her good things, Set the mood right before you have sex. I can assure you, your wife will be so lubricated before you come home. Yes. Or you could even employ the use of artificial lubricants. Don't just jump in. Don't just be selfish. It's not all about you. It's a negotiation, remember? Another common cause are infections. Infections. Now, there are different kinds of infections. Some are sexually transmitted and some are auto-transmitted, meaning you are the one transmitted to yourself. Alright, the very first one we know, a common one, the pelvic inflammatory disease, PID. When a woman has discharge from the vagina, it could be bacterial, it could be fungal, it could be a UTI, a urinary tract infection, it could be a yeast infection. A yeast infection is a fungal infection. It could be honeymoon cystitis for the new lovebirds. This is very common in honeymooners. Why? Because they have a lot of sex. They don't have anything they're thinking about. The whole world revolves around sex because they just got married and it's doing the gish. Honeymoon cystitis. The word cystitis stands for inflammation of the bladder. So when they've had sex so much at times, you can get the bladder infected, causing an inflammation there, causing serious pain during sex, and the woman is running from the man, and the man is offended. Another cause could be an abnormality from birth. It could be from a vaginal agenesis, meaning poor development of the vagina. It could be an imperforate hymen. So these are things that happen genetically. It's not really the woman's fault. It's a factory error from birth. These things could actually be repaired surgically. Some medical conditions can also be responsible for this. You could have endometriosis, a very, very annoying disease laden with a lot of excruciating pain. I will talk about endometriosis extensively in one of my lectures, but for today, I will just keep it simple. Fibroids could be another cause, ovarian cysts, and even a condition called IBS, irritable bowel syndrome. Another cause is rough sex. Oga, calm down. Yes, chairman. 37 kilo. Bashonga. The great lion. You don't need to have rough sex all the time. Before you have rough sex, ensure that your partner is ready and willing. Is she well lubricated? Imagine a woman who is not ready for that because she's your wife. Calm down. And you've turned the whole place up now. Giving doctors work to start suturing. These things can be done with a lot of love and understanding. You know one very funny part? A lot of people think sex is so simple. You can just have sex like that. You don't need a manual, but you're wrong. Sex is just like driving a car. A lot of people have been driving cars for over 20 years and still are not very good drivers. So it means a lot of people have been having sex for over 20 years and are not good drivers. If you know what I mean. If you think you are really good, call your partner and ask her to be very sincere. Ask her to rate you over 100. And men, please be very, very, very sincere and don't get offended. Because if your wife tells you the truth now, you might get offended. Who are you comparing me with? You've been sleeping outside, Abby. Marriage is a negotiation. Sex is a negotiation. You need to enjoy sex. What is the essence of getting married and still you're not enjoying sex? A lot of women are suffering in silence and they can't speak to their spouse about this because they will get offended. Now, every time you want to have sex, the woman is running away and you are offended too. You need to meet your wife halfway. What is happening? What am I doing that you don't like? Is it the way I talk to you? Am I not romantic enough? Am I so aromatic? Or am I too rough? You need to negotiate, alright? How do you like it? When she's pleased, you're pleased. Simple as that. Then the very last point I have here under physical causes is menopause. Of course, when a woman reaches menopause, she starts to have symptoms, premenopausal symptoms as reduced libido, dryness of the vagina. So you expect women who are in menopause to have such challenges. So men, stop getting angry. And yes, there's this popular saying that if a man has sex with his wife who is already reaching menopause, he would have prostate cancer. I laugh at your ignorance. Where do we get all these unfounded ideas from? Believe me, I'm debunking that. That is false. It is not true. Your wife is not a plague. When you have the chance, have sex and enjoy sex. I think a lot of us should go and learn. Not from pornography, but from sex experts, people who are professional about these things. You need to seek knowledge. I can tell you, like I said earlier, sex is like driving a car. A lot of people have been driving for years but don't know how to drive well. Ask your wife to grade you. We don't need to see the score, don't worry. Alright, that's an assignment I'm giving you. Ask your wife when you get home. Madam, please, grade me, score me, be humble, and wait to get heartbroken. Now, for the psychological causes, we have anxiety, we have fear, that's phobias for a lot of things. A woman who is anxious or has phobia or is even depressed would never get lubricated. In fact, sex is the least on her mind. So men, let's be more sensitive. Let's be very sensitive to our spouses. If you notice your wife is not feeling good, if you notice she's depressed, there are possibilities of her being depressed, talk to her more. Women like to talk. Is she stressed? Get her help. Probably a live out or live in house help, someone to ease the stress. A lot of us just go out early in the morning, we go to work and come back later. We don't know what our wives have gone through. Women have to take care of the children, have to take care of the home front, and you come back and want to sleep with that woman who is heavily stressed. You're complaining that she doesn't like sex. You are not being considerate. You only enjoy it when your wife enjoys it. It's an interaction. That's why it's called sexual intercourse, an interaction between two people. Now, it could be both. Now, I mentioned female genital mutilation earlier. A woman who has female genital mutilation would have both a psychological challenge and a physical challenge. The physical challenge is that she won't reach orgasm easily. Now, the psychological aspect is that she feels traumatized. Her clitoris was cut and she wasn't given any form of anesthesia. Now, if your wife has been mutilated, so to speak, has her clitoris cut off, you need to give her extra care, pamper, more foreplay for you to get that sexual desire you desire. Now, how do we make a diagnosis? Depending on the cause, you need to ask this woman a series of questions. From your questions, you'll narrow down if it's an infection, if it's a physical cause, if it's a psychological thing, or if it's both. The treatment could be lifestyle modification, changing your sexual behavior, becoming more sensitive to your spouse, understanding that it's not a one-sided thing, it's a two-sided thing. It's an interaction you need to have, you need to enjoy, you need to interact, you need to communicate with your wife. How do you like it? Have I been so rough? And now we have a lot of men who complain about, doctor, yes, I used to do 30 minutes before, I used to do 1 hour before, but now I can do only 15 minutes, I can only do only 10 minutes. Stop bragging, stop lying. You might most likely need Kegel exercise. Yeah, Kegel exercise will help you improve the strength of your pelvic floor so you don't ejaculate so fast. You need to seek help. Be very humble and stop feeling like, the chairman. It's not bruising your egos. Yeah, seek help early before you wreck that marriage. You could also require medications, especially if it's an infection, if it's from a medical condition or something that will require drugs, even psychologically. Your doctor will be in the best position to do that. Lastly, counseling is very important. Yeah, a lot of people need counseling, especially people who are going through depression, anxiety. Yes, both parties, both the man and the wife, need counseling. And please, I have been mentioning women. Hope you understand that dyspareunia could be either a male or a female thing. It's just commoner amongst women. Maybe, or our men just bottle it up because of their ego. If you just love this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.